Hi everybody. This video is going to help us get started with creating our pivot table for the final course project. So all of you at this point should have your Sparks data set for your particular county. So to give you an example and an overview for how to do this, I'm going to be using Oswego County. So as you can see here, I have my Sparks data up. This is from 2016 for Oswego County. There is one thing we have to do first in order to set up the columns to do our analysis. And there's one issue with the data set from Sparks that we have to correct first, and that has to do with length of stay. Length of stay is going to be a really important aspect of our analysis because we need to be summarizing all of the length of stays for different age cohorts so that we can understand the total number of patient days certain age groups are staying at our facility. So the problem with the Sparks data set is when they send it to us, unfortunately, these, although their numbers, are listed as text. Now, typically what we'd be able to do is just highlight the column and change the formatting here to a number. But for some reason in this data set, when we do that, when we make that simple change, it still doesn't show up when we use our pivot table. I'm not totally sure why. I've tried it a number of times and it's not working. So here is my quick fix for getting this to transfer to a number. So we're going to go to the column right next to it, which is zip code. We're just going to do control, insert a new column right here. And I'm just going to name this LOS for length of stay. So in order to create a numerical number for length of stay, I'm just going to do a formula equals, I'm going to highlight this cell, plus 0. So when we do that, that's going to translate that over to just a number for us. So Oswego County, compared to the rest of the counties in the state, is very, very small. I could probably drag this all the way down to the bottom. It would take some time, but for those of you that are looking at counties that are much larger, especially those downstate, you're not going to want to do that. So an easy way to copy this formula down the entire column is to just double click when you go on the right hand, the bottom right hand corner of the cell, just double click on it, and that should copy all the way down to the very bottom of our table. And it did, so that looks great. Okay, so now once we've done that, we can go through and we can create our pivot table. And just briefly, I've included all of the variable names, but of course, I'm just gonna go through them really quick. For sex, we have male and female. Again, these are all of the admissions that either one, took place within Oswego County or are Oswego County residents that received care outside of the county. So maybe they went to Onondaga County, to one of the Syracuse hospitals. They're gonna be in this data set as well. So again, it's anybody that received care in Oswego or is from Oswego, and it's going to include the care they received from their specific hospital and county. So we've got ethnicity, we've got newborns, which we won't be using for analysis. HSA is our health service area. It breaks it down by different regions across the state. For our analysis, we're not going to be using this. Service category. This is fundamentally important to our analysis because we're going to be looking at different service categories and we're going to basically be making a hypothesis as to whether we should add or reduce beds. So this is important for us. We've got race, patient state. You might see that we have in your data set, depending on where you're located in New York, that you've got patients coming in from other states. We see this a lot in counties like Broome County, which would have patients coming in from Pennsylvania. We've got patient county here, and this is the patient county code. Admission hour, so the hour that they were admitted, their discharge hour, disposition, so where they went after they left the hospital and were discharged. Reimbursement code, hospital county, so this is the county in which the hospital is located. So you'll see we're gonna have a number here that are from Oswego, but we're gonna see other hospital county codes as well for those patients that live in Oswego County but received care elsewhere. Age of the patient, the day of week that they were admitted, so this is admission week, but it's the day of week they were admitted, discharge day, length of stay, again, which we've converted to a numeric value, the zip code of the patient. PFI is permanent facility indicator. This is a Sparks code or number that is associated with each specific hospital. Total charge, so these are the total charges for the patient's stay. It does include 2 decimal places. So if we look at this patient in this first column, this would be in 34 cents. So, right, we would assume that there was a dot in there. So this total patient stay was, let's see, about just over $11,000. So we've got patient city, which is the name of the city for where the patient resides. And then we've also got facility name. So there are a few different ways we can do our analysis here. When we're looking at the specific hospital, we can choose PFI or facility name. All right, so in order to get started, let's go ahead and set up our pivot table. So again, once we've got the length of stay column corrected, we can just click on the left-hand corner right here on the sheet, and we're gonna go to Insert, Pivot Table. And we can choose to put it on the existing worksheet, but since this worksheet's so big, let's just keep it selected as new worksheet, and that's gonna create a new tab down here for us with our pivot table. All right, so here it is. Here's our pivot table. We've got all of our field names, which are our variable names, listed here in this box above. And basically what we can do with a pivot table is just highlight these and drag and drop them into these different sections to help us do our analysis. So again, pivot tables are awesome when you've got really large data sets. Even if your data set is remotely big as the Sparks data, it's really good practice just to be able to know how to use the pivot table. I would encourage you, if you have any data at your facility, something that maybe somebody works on for you, ask for the raw data and just practice with the pivot tables yourself. And I think getting that control over the data is really interesting, because then as you ask questions, you don't have to ask them to somebody else. You can actually just go into the raw data and answer them for yourself, which is wonderful. Okay, so first things first, to set up our pivot table for the analysis, one of the first things we're gonna do is, let's just go through these. Let's just click on sex here, and it automatically brought it down here into our summing of values. Let's move that over into, actually, let's move it over into columns. So we're gonna see for all of our data, it's gonna sort it in different columns based on whether it's female or male. So we're also going to want to do, for a lot of our analysis, when we start out with that first county utilization tab, we want to make sure that we're only doing the analysis on that tab for patients from our county. So we're going to choose patient county. Let's bring that up into filter. So we can say, for Oswego County, we're just going to want to look at patients that reside in our county. We can also, let's pull in service category. So again, we're going to differentiate between med-surg, pediatrics, obstetrics, and psych. So when we do our analysis, that's going to be important. And then as we look at our project template, age is also critically important to do this analysis by age cohort. So we're going to click on age. We're going to move that over. There's a couple ways you can do this. Let's just move it into row right now. And then when we sum values, there are a couple different ways we can do this. If we go to our LOS, our length of stay variable here, I'm going to click on that. So what a pivot table does is, there are a number of different options that are going to help us analyze our data. So when we are doing our initial analysis, looking at how many discharges happened by county residents, we're actually going to, when we click on that little informational icon there, it's going to pull up this source field box, and we're going to switch that to count. So when we count length of stay, what that's doing is it's counting every time that cell is identified, right? So if we say we're going to look at all patients that are females from the age of 15 to 19, every time there's a length of stay box, it's just going to count them. So basically what that does, and you could put any variable in for that when it counts it in the data set. Basically what it's doing is saying these are the number of admissions, because we know in our data set every row indicates a separate admission to a facility. So if we do that, that's basically telling us the total number of discharges. When we use that length of stay variable, we can also switch that to sum. So when we switch it to sum, basically what that's going to tell us is the total number of patient days, because it's going to add up all of those individual length of stays for all of those patients, right? So when we count it, it's literally just counting the number of times that box is there, which corresponds to how many admissions there are. And when we sum it, it's going to be adding up all of those values, which is going to correspond to our total number of patient days. For now, since the first analysis that we want to do at the county level is just counting discharges. We're gonna switch this over to count. And what we also have to do before we do this analysis is double check and make sure that we know what our patient county number is. So let's do that for Oswego County. I am just going to pull up, I'm gonna switch over my share so you can see what I'm Googling for. So I'm gonna go to Sparks, New York, and it's going to bring up the Sparks website, which stands for Statewide Planning and Research Cooperative System, Sparks. And there's a lot of information here. It is not super organized. So where we're going to go, there's a link to an appendix on here, which is very useful for this project. The way we get to it is by going to Data Access. And it's going to give us a number of links down here. So new release notes, which they just pushed out in February, talking about some of the issues with the new data release. What we want is the data dictionaries. That's basically telling us how all the different variables are categorized within the data set. So we're going to go to this second one, this old format after July 30th, 2012. That's the data we're working with right now. And it's got a lot of information on the inpatient and outpatient Sparks data sets, but for now we want to go down here to the appendices, inpatient and outpatient. And if we go to Appendix F, which lists our county codes, I want to just double check and make sure I know what the Oswego County code is. So if I scroll down here, Oswego County code is 35. Okay, so I'm going to flip back to my pivot table here. So I'm going to say for the first level of analysis and count on the county utilization tab, I only want to look at Oswego residents. So I'm going to deselect all of the other county codes, and I'm only going to focus on those residents of Oswego, which are county code 35. And to start, I want to look at Med-Surg, the service category of Med-Surg. So 1 corresponds to medical admissions, to surgical. So I'm going to highlight both of those for right now. And then using the pivot table, right, we've got female, male, we've got all of the ages here. So to do the analysis then, if I just want to look at that first line, which is county residents aged 15 to 19, I can deselect that and I can just go through and say, okay, I want these ages. And so what this is going to give me is that in Oswego County for the year, there were, for this age cohort, for the 15 to 19-year-olds, I had a total of 98 male admissions for any medical or surgical reason. And there were 74 total admissions for females as well in that year for that age cohort. So what we're going to do is go through and do that analysis for all of our age cohorts. What I would suggest is that before you move on to the next age cohort, what's easier is that we're going to do this analysis for the total number of discharges, but we're also going to do it for the total number of patient days, which is going to help us to get a sense of total occupancy for the facility. So that's the next set of tables located in the project template. So before I go on, I'm just going to go over and I'm going to switch this to sum for that age cohort. And we can see that now it's giving us the total number of patient days. So for males, Med-Surg category, service category, in this age cohort, we had a total number of 365 days, and for females, a total of 213 days. As I continue to make videos for the different portions of the project, I'll go through and give you more detail on how to set up your pivot tables. But for now, I think your first step in just getting the pivot table set up, making the modifications to the length of stay variable is what you need to get started. As always, if you have any questions, please don't hesitate to reach out.